Good evening, UMA students. Instructor Pamela here, and welcome to your Week 5 assignment feedback. This week we focused on our evaluation and management codes, or also called E&M codes, as well as your HCPCS codes from your durable medical equipment or your HCPCS actual book. Now, your evaluation and management codes are special when it comes to coding. Remember that your CPT book houses the evaluation and management, or E&M codes, in the first section within the CPT book. And remember, the most important thing to keep in mind with your E&M codes is that they encompass both inpatient and outpatient facilities. A lot of coders would like to distinguish the books from an inpatient coder or an outpatient coder, of what books they would use, but in reality, you will always use your ICD-9 book for your diagnosis codes from your volumes 1 and 2 codes, and if you're working for an outpatient facility, you will be utilizing your CPT book, but in particular or specific sections. So your evaluation management codes, they encompass inpatient and outpatient. And how you determine this, if you go ahead and review each of the sections of the guidelines, you will see how they pertain to each different department or unit within an inpatient facility or an outpatient facility. For example, your codes for 99201 to 99205 are for all new patients for a physician office visit. And your codes from 99211 to 99215 are for your established patients for an office visit. And all of the guidelines before the codes will give you a description of how you understand this or how you would apply this to determine if you're coding from the right section. All of your evaluation and management codes all start with your 99, and depending on what department, what unit, or what facility you will work for in the future will determine what code you will actually assign. So let's say you are working for a skilled nursing facility. Therefore, you will be dealing with patients that are at the end of their life term for illnesses and for many other purposes. However, if you go to skilled nursing facility within your evaluation and management section, you will see the codes, which will start with 99, and there's maybe about 4 or 5 or even maybe up to 6 codes that you'll have to assign for the service, as well as the next step would be to assign the actual diagnosis. Why is the patient in a skilled nursing facility? Is it because of dementia? Is it because of end-stage renal disease? Is it because of a malignancy? Whatever it may be, you will always have a diagnosis code from your ICD-9's volumes 1 and 2, and you will have a service code from your evaluation and management code for either inpatient or outpatient services. And again, just make sure you read each section before each area, and it will tell you how to assign the codes appropriately. The other part of your assignment focused on your durable medical equipment, which comes from your HCPCS book, which is that HCPCS book that everybody's like, what is this? Well, again, durable medical equipment is the key. Any type of place that you may work for in the future or work for now, they may have different types of products that the patients need to utilize for their treatment procedures, or whatever it may be. The HCPCS book has different medications. They have wheelchairs. They have prosthetics. They have different screening tests for patients, such as mammograms or prostate cancer. So depending on where you work at will determine if you use the HCPCS codes or not. But always keep in mind, you will always know because you are applying for the job, and you'll know if you'll be working with the HCPCS books. So with your assignment, you just wanted to make sure that you did your format for your APA format and answer all of the questions. So you did a great job. And as always, until next time, Instructor Pamela here. Keep up the great work, and I will see you next time. Bye-bye.